Hello and welcome back. We are now at Module 5, where we're going to discuss further things regarding the vet's role and introduce the therapist's role into helping you as an owner manage your dog's arthritis. We've already covered quite a lot, such as what is arthritis, what is the fuss, why has my dog got arthritis, and what we can learn for the future. The clinical appearance of arthritis and the difficulty in actually monitoring it and observing it. The role of caregiver placebo effect. And in the last module, we started to touch on the importance of diagnosis and the vet's role. So just looking at the diagram again of the true multimodal management of arthritis and how it involves the vet and the owner, and what the areas that each party must do to get a successful management plan. We've tackled non-steroidals. We're now going to cover the next section. Additional pain relief. So as we know, the pain pathway is very complicated. Far too complicated for a simple vet like me. But what it does show is that there are many areas that we can intervene in this pathway, from stimulation to perception. Pain control, as we know, is very complex. So chronic pain medications available. Unfortunately, there aren't very many licensed oral pain controlling medications. The one that comes to hand readily is Pardale V, which is paracetamol and codeine. The other medications that we practitioners readily resort to, unfortunately, have very few studies regarding their use. So this means that the evidence is thus weak and can be based on the experiences of a few vets in the form of case series. Often vets with an added interest in pain management will have gone on extra courses and have a lot more experience in this field. The reason I say all of this is that adding chronic pain medications to your foundational non-steroidal anti-inflammatory drug often involves a lot of experience. And there are many vets out there that have their own experiences. When a vet prescribes any drug, they are taking responsibility for that case. And often, if they've had a previous nil effect or poor effect or adverse effect with a pain medication, they may be unwilling to experiment further. So these are a list of the chronic pain medications used. It's an extensive list, but as stated, there is not a lot of evidence of using them orally long-term in animals. What is exciting is we have many more analgesia options becoming available. There are huge developments in this field. We've already talked about the new non-steroidal anti-inflammatory drug, which we hope is going to become more specific, so therefore less likely to cause side effects. We have monoclonal antibodies that are actually more specific and will help with the peripheral sensitization reduction. We also have intra-articular therapies, such as platelet-rich plasma, stem cells, and other things that we can actually put into the joint. This is a rapidly expanding field with some really exciting results, where we actually get to influence the disease locally. So let's just stop and look at clinical reliability before moving forward. We keep touching on how vets want to use evidence-based medicine. What does that mean? So this pyramid shows the structure of reliability, clinical reliability, with the peak of the pyramid being the most respected form of evidence-based medicine. The lowest form of evidence-based medicine, i.e., does a product work, is in vitro research, which is where you're actually taking cells out of the body and manipulating them in a body environment, such as an agar plate. This is not actually looking at cellular function in its true environment. We then have people's ideas and opinions, editorials in magazines. Then we have people using their rationale. It should do this. The literature suggests it should do. We have research in different species that may respond to the drug differently. And then we go up the triangle, case reports, case series, models of disease. It shows that actually evidence has to be interpreted of its reliability. It can make it extremely difficult to wade through what is true and what is believed. The highest clinical reliability is those systematic reviews, where numerous papers looking into the same topic area are reviewed. It is very common for one clinical paper to show effect, but the same trial to be performed by another group and show no effect. By looking at numerous trials and bringing all the data together, you will have a much more reliable overview of effect. So this brings me on to a topic that many owners contact CAM for further information: CBD. Currently, this is creating a great deal of interest. It's easily accessible, it's been featuring in the news, it's considered natural and holistic. Some people believe it's slightly naughty, it's the wonder drug, and it can be accessible without having to visit your vet. So just a quick overview. The actual plant it comes from is Cannabis sativa. CBD is one of 100 substances collectively known as cannabinoids. The one that we frequently know about because of its psychoactive effects is THC. Cannabidiol, CBD, does not have these psychoactive effects. It is a different substance to THC. Its precise mechanism of action is unclear, but there is evidence that it can have pain-relieving effects from the small number of clinical trials. The problem is there is no licensed CBD product in the UK for either humans or for the veterinary market. Recently, the CBD products were legislated as a medicine, and to be treated as a medicine, they must have marketing authorization, meaning that they need to have performed sufficient clinical trials. There are not sufficient clinical trials for it to safely come to market. So currently, it is not permitted to purchase or prescribe CBD in the UK. What we do know is, because we know very little about the product regarding safety, quality and efficacy, there are no CBD products in the UK market that can be prescribed or purchased. The small trials that were performed, one was done in the Cornell University involving 16 dogs. There is another trial from Colorado State University involving 24 dogs. As you can see, the number of dogs in the trials are very small. No definitive conclusions have been made, but we have got promise. The results are exciting. Unfortunately, we are getting more reports of side effects and toxicoses. We also have reports that because of the readily available nature of the CBD product, which was originally classified as a food product, means that there is a hell of a lot of mislabeling. Some of the products having very high concentrations of CBD, some having very low. We also know from human studies that CBD is metabolized in the liver, and this can have potential drug interactions because the liver is the mainstay of metabolizing other drugs going into the body. Can CBD influence their ability to be processed? Some drugs need to be metabolized to become active. Some drugs need to be metabolized to be got rid of. Could CBD interfere with other drug function? We also know that CBD can increase liver enzymes, which is believed to be causing liver damage. We still don't have enough robust or reproducible information about CBD, and many uncertainties remain. I'm going to take this opportunity to just mention my story. My dog is on multiple different chronic pain medications. And on introducing CBD, we did see serious side effects. I believe that the CBD will have affected her body's ability to process the other drugs. I chose not to give it anymore because I was concerned at how little we actually knew about it. This is why vets are reluctant to discuss it, mention it, and they certainly cannot prescribe it because it is not available for prescription in the UK. But less of the glum, let's get some more of the fun. This is a friend's dog, Sheba, having canine enrichment, which can have a powerful effect on pain control. So back to our true multimodal management of arthritis, looking further at what the vet can do. Let's talk again about weight control. This is more important than anything else, and it's free. We know that weight control affects the onset, progression, and the pain of this disease process. It affects quality of life, but it's completely under our control. I know very few dogs that can open the cupboard door, open a tin, and empty the can of food into their bowl. We are in control of feeding our pet dogs. Remember Fudge? This is her before weight loss and house adaptations. And this is her after weight loss and house adaptations. Nothing else. So as you can see from that video clip, there is a massive difference in this chocolate Labrador's ability to move. I was very lucky that the dog chose to walk through the door in the same way for each film, but this dog had lost around about 5 kilos between these two clips, and you can see a dramatic difference in the way that that dog moves. So let's talk about obesity, and I'm going to refer to some work from Associate Professor Nick Cave. The elephant in the room is most certainly obesity. It's the single most common nutritional problem in pets globally. We see a huge number of overweight dogs as first opinion vets. What do we think the cause? Diet, insufficient exercise, the human relationship, and also owners' inability to read their dog's body weight, their dog's body size. What we found is that obesity tends to start early in life. It isn't a disease of the older dog. It's often started in their juvenile years. Yes, it is influenced by neutering, because neutering removes estradiol, and estradiol will suppress food intake. So with lower levels of estradiol, you have increased intake of food, which therefore increases body weight. It is actually quite simple. We should feed the energy requirements of our dogs only, and formulas exist to help us. However, there is a massive range in feeding guidelines that try and use these formulas. Often on the back of packets, there's plus or minus 50% for each weight category. Using the packet guidelines can be very, very inaccurate. We also have the additional problem where owners believe that more food is more love. The way that we choose to feed using a cup or a bowl or our hands is very, very inaccurate. A study at the University of Liverpool using 1 cup found that between a number of handlers, the weight of that cup could be 18% less to 80% more. So even the simple cup can lead to feeding inaccuracies. Ideally, what we would wish to do is feed them to their body condition. So to look at the actual shape of the dog, their fat coverage, and to tailor their diet accordingly. If their body condition score is high, reduce their intake and wait for their body condition to drop. However, we know globally that owners underestimate body condition score. And what's worse, as the animal gains more weight, their ability to interpret their body condition score gets worse. This is why lots of vet practices offer weight clinics. It allows the owner to have a second opinion. Often owners come to us saying, "Doesn't he look great? He must have lost weight," when actually there's no change. This is my sister's dog, again, demonstrating the influence of weight control. You could see an obvious limp, which disappears having lost the excess weight. Very proud of my sister. So going back to Dr. Cave, it's a completely preventable disease. It's not a disease of nutrition. It's actually a disorder of human behaviour, and it's extremely complex. There is no single solution, no simple nutritional solution. There needs to be multiple interventions. Pet food is not the problem nor the solution. Now, I tell you this because generally weight loss is fully achievable by that owner when they learn to read their dog's body condition score and they are firm with themselves, potentially having second opinions. By controlling what we give, how much we give, how often we give, we can get our dogs to an optimum body weight, which we know will affect the onset, the progression, and the pain of arthritis. So let's continue with nutrition. And these are questions that have been posed to Cam many a time. So we'll cover them quickly now. Is grain-free diets better for arthritis, with the belief that they're less inflammatory and they're likely to reduce the existence of allergies? We approached Tufts University, their vet nutrition independent department. There is no reliable evidence that suggests that it's harmful to feed grains as a group to dogs or cats. Whole grains, rather than being fillers, can actually contribute valuable nutrients, including vitamins, minerals, essential fatty acids, and fibre to diets. Some grain products even provide protein that is easier for your pet to digest than some protein from meat. So at present, there is no evidence to suggest grain-free diets are better for dogs suffering arthritis. Raw food. Raw feeding supposedly improves immune system, better coat quality, better teeth quality, better breath, better weight control, and improved mobility. I would like to draw your attention to how the market has rapidly grown from 2012 to 2016 from $117 to $393 million. The cynic in me just wants to point out that it is an extremely lucrative market. Looking at the evidence that is currently available, there is no proof to confirm any health benefits beyond a few stories. We do, however, have proof that there are risks, so until there is evidence of clear, important health benefits to cancel out those risks, we can't recommend raw meat diets. It's an extremely exciting area, and we know that further studies are being started and performed, and hopefully we will have more information. But there is no evidence to suggest that you, as an owner, should feed your dog raw. Homemade diets, that they'll be better quality as no byproducts, no artificial preservatives, and no grain. An independent advisor has spoken about how there are hundreds of different homemade recipes of all different qualities, numerous available online. The problem is not all of them are being nutritionally balanced. And what they have found is owners with these recipes start to drift within a few weeks. So the original recipe, balanced or not, is actually ignored. This is quite a concern because we know that we need to be providing our dogs a balanced diet. So please do not feel that you are a bad owner if you are not feeding a homemade diet. Senior diets, believed lower in fat and better for the liver and kidney. Current feeling is there is no reason to switch to an older dog or senior diet. If your dog is comfortable on what they are having, their body condition score is optimal, then stay on it. Bone broth, claimed to be good for health, mobility and coat, packed with glucosamine and chondroitin. At present, there is no evidence, only anecdotal to support. There's a huge variability in what is in these bone broths. We believe there's no harm, but we do wonder whether it can affect weight and weight gain. We try and explore evidence-based medicine with any of our replies, and reference sites for the following information was from Vet Nutrition at Tufts, the World Small Animal Veterinary Association, and a company called Balance It that use board-certified veterinary nutritionists. So continuing with what the vet can do, we're now going to talk about cartilage support. There are a number of products that vets regularly recommend, one of them being Cartrophen, pentazan polysulfate sodium. Available in the UK, but there are equivalents in the US under the name Adequan. These are believed to reduce cartilage degradation and reduce the synthesis of degradative enzymes and mediators, as well as help synthesize components for the cartilage. There is evidence of beneficial effect. Glucosamine and chondroitin sulfate. Believe it or not, the jury is still out. There's so much variability in the quality and quantity, form and bioavailability of these products that are readily accessible on the market, be it human products or those tailored for the canine. What we believe is that they positively influence cartilage cells, chondrocytes. However, a lot of the studies were done in vitro, i.e. these cartilage cells were tested not in the joint environment. There is evidence that they can reduce inflammation, but currently we still do not know whether they reach the joint in a usable form and in high enough levels, so the jury is still very out. Undenatured type 2 collagen. So this is from chicken sternum cartilage and they work completely different. It causes an immunomodulatory effect, suppressing the T-cell mediated inflammation within the joints. It is believed to slow down cartilage damage, and it has been shown to be helpful in dogs with moderate to severe arthritis. Avocado unsaponifiables. There's some evidence, but more so in the human market. It's a third avocado oil and 2/3 soybean oil. It is believed to have the best beneficial effect if initiated early in the disease process. It increases the chondroprotective factors found within the synovial fluid. So let's talk further about supplements. It's a multi-million pound business. It's seen by the public as safe and natural, and marketing that is often employed supports this misconception. There are many studies out there, but they're often inconclusive, and comparative studies contradict findings. This means that one study looking at glucosamine and chondroitin sulfate will show positive, but the same study with a different group of dogs will show no improvement. Many of the studies are of poor quality with small populations of dogs and for only short durations. The regulation on the nutraceutical supplement market is through the Food Standards Agency, who are more interested in the safety, the composition and the labelling rather than the clinical benefits. Manufacturers of supplements do not have to prove any clinical benefit. Unfortunately, that means that many owners succumb to finances being wasted. It is an area where there is great hope and we look for many more clinical trials. However, currently it's a very lucrative part of the industry with a lacking in evidence. One way that we help owners navigate their way through the supplement market is following the Acclaim setup that Stephen M. Fox came up with. Use an established firm that provides veterinary education, a firm that invests in clinical trials and publishes their data in respected journals. Make sure you use a product where all ingredients are clearly indicated on the label. If the label claims sounds too good to be true, they probably are. Use a product that has clinical trials rather than simple testimonials. Any labels suggesting that they treat arthritis, cure arthritis, or prevent arthritis are likely to be suspect, and in the UK are not allowed. We want to use products that actually give dosing recommendations that are accurate. We should see a lot identification number on all products to ensure that the product is of good quality, and if surveillance was needed, it could be traced. The manufacturer's information and link to websites should also be available. Talking further about supplements. So the omega-3 fatty acids have the most evidence of effect. Omega-3 fatty acids, EPA and DHA from cold water marine fish are well absorbed through the diet. The ones from plant-based, such as ALA, are not as bioavailable and is a precursor of DHA and EPA. So large quantities of it are required to convert it into DHA and EPA, but we don't believe that it's converted very efficiently. Omega-3 fatty acids have been shown to have an anti-inflammatory, anti-arrhythmic and anti-thrombotic properties, which means it doesn't cause clotting. Omega-6 fatty acids are actually known to be pro-inflammatory and pro-thrombotic. So what we aim to do is compete with omega-6 fatty acids using larger quantities of omega-3. So by increasing the level of omega-3 fatty acids in the diet, we can outcompete the omega-6 fatty acids, which leads to less harmful inflammatory mediators being produced. Turmeric. The active ingredient of turmeric is believed to be curcumin, but there is debate about whether whole turmeric or the derivative curcumin is more effective. There's a wide variety in quality and bioavailability. It's generally marketed by being put into an oil because it's poorly soluble in water. And they believe that by adding black pepper, you can delay its processing so it remains in the system for longer. Studies that have been performed show it reduces inflammatory mediators, but in vitro, i.e. the studies have been performed on cells outside of the body. Most trials that are looked at are done on humans and lab animals, and with available trials specifically on dogs are small in number. What we do know is turmeric can upset the gut, it can cause gallbladder contractions, and it can interfere with the metabolism of non-steroidals, leading to side effects. So hopefully we've covered the supplements. It's an extremely difficult area to advise on in a very independent, non-biased fashion. CAN believes that people should explore using supplements and nutraceuticals, however, not at the detriment to having an appropriate diagnosis and evidence-based medicine treatments. We would like to feel that supplements have their place in a management plan, but we wouldn't want an owner to be pursuing using supplements with no clinical effect and leaving that animal in pain. So now on to the next section, physical and complementary therapies. This is a huge topic area and very hard to put into a small amount of time. At present, there is a lack of trial evidence. The nature of assessment, these individual therapies and the individual therapists mean it's very, very hard to trial these therapies to prove beneficial effect. But as owners are beginning to demand these therapies in addition to their veterinary intervention, we will be able to collect more data. What they definitely do rely on is the skill of the provider, the therapy itself, the equipment, and the training. Commonly employed complementary therapies are hydrotherapy, acupuncture, laser, massage, and physiotherapy. But why add more to your management plan? Well, let's just look at what complementary therapies aim to do. They all fit under a heading called rehabilitation, which means using a variety of therapies or interventions, return to function. What does return to function mean? It means providing a minimal pain state with maximum achievable mobility and a good quality of life. Minimizing pain is achieved through using different therapies, often concurrently or in succession. A key quote from Dr. David Dicus: reliance on a unimodal strategy of using non-steroidals alone is no longer considered an acceptable approach to managing arthritis. This means that non-steroidals should be employed to control the pain of the disease and the inflammation, but also to allow a window of opportunity to introduce other interventions that potentially have less chance of side effects and maximal efficacy through focusing on rebuilding function, strength, and stamina in the surrounding tissue. Please go back to Module 1 talking about arthritis. It's not just a disease of the joint. It also involves the soft tissues surrounding. It affects the whole limb. It affects the whole body due to compensation and weight shifting. These create secondary sources of discomfort. What we have to remember is that we are trying to reduce the overall pain state of that dog. And that means employing different strategies to approach the different sources of discomfort. What we're aiming to do is to get maximum achievable mobility. And this isn't just done through reducing pain alone. It's focusing our attention onto the compensatory changes, as well as strengthening the soft tissue support structures that allow function. Rebuilding the soft tissue structural support to stabilize the underlying joints may require other interventions such as physiotherapy, rehabilitation. Approaches such as therapeutic exercises, hydrotherapy, acupuncture, and massage can be beneficial as part of a treatment plan. Fact: currently we have no ability to predict which permutation of therapies will be effective for each dog. And we do know that the specific combinations will not necessarily be appropriate in the long term, as osteoarthritis is a progressive disease with a fluctuating clinical picture. Thus, to achieve a continuous minimal pain state, the owner must be educated to monitor for signs of discomfort and approach those in charge of the case to action a treatment plan modification as required. This means there is no cookbook approach to OA management, but it rather has to be patient-specific. So what is the concern from the veterinary aspect of employing different therapies into this one treatment plan? Generally, these therapies, complementary therapies, rehabilitation, physio, etc., are accessed outside the practice. And the practice might not have a relationship with the practitioner. So we need to look at the academic qualifications of the person delivering the therapy. We also have to consider their experience. Is that complementary therapy right for that dog, their personality, their disease, and at that time? Will the therapist be able to detect complications? For example, a dog going to physio for arthritis of the knee and not improving. Will that physiotherapist then detect that things aren't progressing as they should do and send that case back to the vet for further attention because of a potentially unstable cruciate? We also worry about the loss of communication with the owner and the therapist, because these activities generally happen outside the practice. We also have to consider the therapist's beliefs. And many therapists believe in their therapy and others. As a vet, we are very aware that that owner is going into a different advisory environment, which leaves us in a pickle, because all vets want to do the best for you and your dog. And the last thing that we want to do is deny your access to a therapist or complicate it by referring you to an inappropriate therapy. So many therapies and therapists that are convinced that they can and will help. How could you ever advise safely, was how I felt in 2016. My only solution, every time that I refer, I discuss it with the owner. I talk about the therapy and what that therapy aims to achieve. If the owner knows what that therapy aims to achieve, they have an expectation. I also advise them what to expect, the service, how it should run, what they should see the therapist do, how that therapist should handle their dog. I talk about red flags. If something is being done that fits into a red flag, the owner should be aware of it and note it in case that therapy, that therapist, that situation isn't suitable for their dog. I try to give the owner an expectation of time till effect. If you are seeing a therapist and you are seeing no improvement after numerous visits, you as the owner need to be able to say, I do not feel that this is working for my dog. I would expect the therapist to provide a report, and that report should go to the owner and the vet. And through teaching the owner to be objective with their monitoring, I hope that they will be able to control their experience and their commitment to alternative therapy. So let's talk about this objective monitoring. We touched on it previously because of caregiver placebo effect. The idea behind objective monitoring rather than subjective monitoring is it avoids harm, what we call financial toxicity, where money is being invested on therapies that aren't actually showing any promise. And it also helps us challenge caregiver placebo. Subjective monitoring is, I think he's better. I think he's brighter. I think he's moving better. Objective monitoring is actually being much more specific. It also has the ability to reduce confusion and emotion. It potentially can help detect comorbidity. So if you see a deterioration in your objective monitoring, but the arthritis is actually stable, is there another condition also happening? There are many validated tools, Load, Coast, CBPI, Helsinki, Cincinnati, all of these are available online. And if you speak to your vet, they will be able to go into a greater detail regarding of the availability and how to use these. What I do need to remind people of is something else that a lot of owners don't know. It's called regression to the mean. This is when it is by coincidence there is a natural improvement with the introduction of a therapy. This means that you may start a new course of hydrotherapy, physiotherapy, massage therapy, laser therapy, whatever it may be. And at that moment in time, your dog was actually naturally improving. And the therapy, therefore, is applauded for effect. This is extremely complicated. What do we do with this information? We suggest you look for consistent improvement and not hang on your hat onto just a one-off improvement. Now, what I need to remind people of is an often overlooked side effect, very, very infrequently talked about, is lack of action in an appropriate time frame. Going back to module 2, arthritis is a painful condition. Choosing therapies, supplements, drugs that are ineffective in itself is a side effect. A way to measure objectively, which we find very easy and accessible to owners, is using client-specific outcome measures. We feel it has many benefits to the owner, including empowering their client to monitor their own pet's pain and make decisions. Improves the owner's adherence to the treatment plans. They feel involved. It also looks at the emotional state as well as the sensory affective states. Please remember module 5, where we talked about how pain can affect the emotional state of the animal. You can see an improvement in their emotional state if you're getting it right, but their physical capabilities might not change or be slower to change. And using client-specific outcome measures, we can take account for that. So, what we're going to do is talk through the download that we have on our website that you are welcome to use. As I say, it is an unvalidated tool. Validated tools for your use you can get from your vet, such as Load, Coast, the Canine Brief Pain Inventory, etc. But this is freely downloadable. I'm just going to talk to you about the objective measurements that I use in my own dog. So this chart here, there are 3 sections on the left. It's the number of the assessment and the date, overall demeanour, so overall emotional state, overall mobility, and then to the right you can see chronic pain indicator 1 to 5. Let me talk to you about my own dogs. So, this is Holly. These are the things that I look at to work out how she is doing. The position of her ears. If her ears are up, engaged, she's enthusiastic, it's a good day. If they're back and down, we're having a bad day. Her tail. If it's up and held high and she struts forward, it's a good day. When it's limp and hanging vertically down, it's a bad day. When her back is arched and her pelvis is tucked underneath her, I know it's a bad day. But when her back is flat and she seems to stride out with confidence, it's a better day. If she is walking with a whisking, short-stepped gait in her hind limbs, it's a bad day. But when she strides out with confidence, it's a good day. If I hear her dragging the toes of her right hind, I know it's a bad day. But when I don't hear that, I can assume we're having a good day. And when I touch her and she's happy for me to stroke her or massage her, it's a good day. If she moves away from my hands and tries to get away from me, it's a bad day. I use these indicators to look at how my dog is doing. And it means that I can monitor more closely whether something has improved her quality of life, her clinical signs. I find it very useful, and I know a number of other people find it very useful because it can be tailored to your dog. The downside to objective monitoring is it can be a bit emotionally draining, and I know this from my own experiences. You can become very focused on the day-to-day changes, and as we know, arthritis waxes and wanes. So what I would suggest is that you do it on a less frequent basis and you approach it in a more methodical weekly manner. Arthritis is a changing condition. We have to be aware that it does deteriorate, and we do see a progression. So what these client-specific outcome measures aim to do is keep you alert so that you know when it's time to introduce a change of plan. Let me explain that a little bit more. Holly's clinical signs can change daily, but if I saw her tail down, her ears flat, the arch of the back there, for 3, 5, 7 days, I know something needs to change. If I have a bad day followed by 3 good days, I don't need to change what I'm doing. I hope that makes sense and is of some help to you. So module 5, whew, it was a long one. We know that the pain pathway is complex, but offers many opportunities for other medications to have an effect. Many adjunct analgesics exist, so many alternative pain reliefs exist and can be useful in managing the pain of the arthritis and are often used alongside our foundational non-steroidal anti-inflammatory drug. However, there is limited data currently to guide the use of these medications. So what you have to do is work well with your vet using your objective assessments. There are many more exciting modalities and medications coming to the market to help manage canine arthritis, some offering less chances of side effects. Weight management is imperative and logical, but owners find it hard to be accurate when assessing their dog's own body condition, so external help should be sought. There is limited evidence to support the use of CBD currently, because we know little regarding its action, dosing and side effects. There is no licensed human or animal CBD in the UK that a vet can prescribe, as it is now deemed a veterinary medicine. There is no evidence yet to support grain-free diets, raw diets, homemade diets, bone broths or senior diets being beneficial. The supplement market is not regulated like the pharmaceutical market, so exaggerated claims and false marketing are commonplace. Currently, most evidence of beneficial effect lies with the omega-3 fatty acids, type 2 collagen, and avocado unsaponifiables, having some evidence of effect. The jury is still out on glucosamine and chondroitin sulfate. Reliance on single drug therapy alone is considered inappropriate when managing arthritis. Employing a multimodal approach is considered gold standard, and this should include weight control, appropriate lifestyle changes, physical therapies, disease-modifying agents. Complementary therapies can be very beneficial when managing arthritis. Different therapies exist with differing amounts of evidence of benefit. It can be difficult for a vet to refer to the wide variety of therapies available due to the variability in belief benefit, the skill and the qualification of the therapist. Owner education regarding objective monitoring is essential.